I'm going to be talking about expiratory time. So expiratory time or time expiratory. So I'm going to put the symbol TE. And specifically, I'm going to talk about expiratory time in regards to mandatory ventilation. So continuous mandatory ventilation and mandatory breaths. So when we're thinking about CMV, this could be either volume control CMV, pressure control CMV, or even dual control CMV. And mandatory breaths, these could be the mandatory breaths that are within SIMV modes. So this could be volume control SIMV, pressure control SIMV, or dual control SIMV. So what is expiratory time? So expiratory time is basically, mathematically, is equal to my total cycle time, which I'll be talking about in another video, minus my inspiratory time, and I've already talked about inspiratory time. However, if we look at this ventilator screenshot, we can use our waveforms to describe my expiratory time also. So I'm going to look at my flow waveform, and I'm kind of highlighting it. And my flow waveform's in red. Those are my flow time curve. And expiratory time is the start of my expiratory flow. So let's say this starts my expiratory time here, and it goes all the way to the start before my next inspiration, where inspiratory flow rises again. So this whole area is my expiratory time, or some people term it as the expiratory phase. So that's my expiratory phase. Now, how does one set expiratory time? So this is not that common in newer ventilators where you actually set an expiratory time. There's usually not settings. However, this older ventilator, this is from a Babylog 8000, we actually did set an expiratory time. And as you notice, if you look at all these control settings, there is not a setting for my frequency. So to get a respiratory rate, it was from setting my expiratory time and my inspiratory time, and that would give me a frequency. However, setting the inspiratory time is the most important, so people usually focus on that and really don't set an expiratory time. And usually the normal setting is your expiratory time is usually set 3 times above your inspiratory time. So traditional or newer ventilators out there, you notice there's no setting for an inspiratory time at all. I mean an expiratory time, sorry. So expiratory time is a component of my respiratory rate. And with this ventilator, I'm actually setting, well, the default here is set for IE ratio. In an IE ratio, I get an inspiratory time, and then what's left over is the expiratory time. Here's another example of a mechanical ventilator. This is a newer mechanical ventilator, and if you look through all the settings, you don't see a little setting down here for expiratory time at all. So expiratory time is going to actually be determined by my frequency setting and my percent inspiratory time setting. Based on that, it will mathematically calculate inspiratory time, and left over will be expiratory time here. So at least in this little smart window here, It shows me what my inspiratory and expiratory times are. So there's many things that affect my expiratory time. One is my IE ratio. One is my inspiratory time. And the other is my frequency, my set ventilator frequency. So all these will affect my expiratory time. So why is setting expiratory time or knowing expiratory time, since we really don't directly set an expiratory time anymore, why is it important? Well, we want to make sure it's long enough to prevent air trapping or to allow for expiration for CO2 removal and allow for just a nice expiratory phase for the patient to empty the lungs. And we can look at that with our waveforms. So you have our waveforms here, and we look at our expiratory phase, and we know we have enough expiratory time because my expiratory flow waveform is returning to baseline. So that's evidence that there's no air trapping there or auto PEEP. I can look at also, this is a nice picture because it looks at I have my capnography, and I can see if patients have obstructive process with capnography also. Loop. And I can assess my loops to see if there's enough time for expiration. If my flow volume loops return to my baseline too. So that's expiratory time.